If your MRI shows that you have an L4-L5 disc bulge and you're looking for help, you're watching the right video. First, I want you to know I understand your worry. And if you have an L4-L5 disc bulge that's causing low back or leg pain, I want you to know that there is good news. There is hope for you. Having an L4-L5 disc bulge has more to do with just low back and leg pain. It has to do with your being able to function and do the things that you love. In this video, I am going to tell you everything you need to know about L4-L5 disc bulge, including what causes it, common symptoms associated with it, and different treatment options that you have at your disposal to handle that successfully. Not only am I going to share that information with you, but at the end of the video, I am going to give you stretches that you could start doing immediately that are likely to help decrease the pain and inflammation associated with a L4-L5 disc bulge. And as a bonus, if you watch right till the end, I'm going to share with you a printout of those stretches. Those are actual stretches that we give to patients in our clinic. We call that world-class chiropractic low back stretches. They're safe and easy to do. So make sure you watch till the end so I can share that with you. Hi, I'm Dr. Steve Silverston, chiropractor in Ellicott City, Maryland, and I bring to you over 30 years of clinical experience helping people recover from low back pain, sciatica, neck pain, upper back, shoulder, arm pain, headaches, and more. This channel is about giving you tips and strategies to help you live a pain-free, healthy, and better life. Before I dive in, make sure you subscribe to our channel to get tips to living a pain-free, healthier, more productive, joyful, and healthy life. In a moment, I'm going to dive in and tell you about causes, symptoms, and treatment options for an L4-L5 disc bulge. Before I do, I want to share with you, earlier I said I understand your worries. And I said that because from the time I was a teenager, I had debilitating low back pain. It was so bad that one time I was in my home, in my parents' home, and I was paralyzed on the floor for 2 hours, and I couldn't even get up onto the bed. Eventually, I was able to get onto the bed, and the next 2 to 3 days I spent in that bed, and I was unable to get up and stand upright. Eventually, I got up, and I was able to move around, but I continued to have frequent bouts of low back pain. And I wondered how I would ever be able to get through life with this problem if it continued. I saw doctors, I saw physical therapists, I tried all kinds of things, and nothing seemed to really get me better until I met a chiropractor who actually helped me more than anyone else. And that actually led to me getting better and becoming a chiropractor. That's why I'm here. Now with over 30 years experience helping thousands of patients, I'm going to reveal to you the most common causes, symptoms, and treatment options for an L4-L5 disc bulge. Now let's dive into the main causes of an L4-L5 disc bulge. Understanding the causes of an L4-L5 disc bulge can help you prevent further injury, manage your symptoms well, and choose the best treatment options. There are 3 main underlying causes of an L4-L5 disc bulge. The first one is physical stress. Physical stress comes in the form of things like accidents, injuries, slips, strains, twists, falls, repetitive stress, just like sitting at a computer or in a car for long periods of time. And all those things you can see obviously can cause injury to our spine and make our disc bulge. The second and third major underlying causes of an L4-L5 disc bulge are less obvious, but still significant. The second cause is chemical stress. Chemical stresses come in the form of food additives, environmental toxins, drugs, smoking, being overweight. Things like that can cause chemical changes in the body, and that can break down the outside of the disc as well as other tissues in our body. And the third major underlying cause of an L4-L5 disc bulge is actually emotional stress. This is probably the most commonly overlooked cause of this problem, but it's real and it's big. We live in a stressful world, and we're constantly dealing with things on a daily basis, minute to minute. And how we cope and how we stress with things has an effect on our body. So emotional stress can translate to physiological stress. Just think about it. If you're in an argument with somebody or somebody just says something to you that upsets you, there's physiological changes in your body. And if you think about it, we're being exposed to physical, chemical, and emotional stresses all the time. So yes, there's the obvious car accident that may cause a disc to bulge, but just as significant and probably even more common and overlooked are all these other stresses we're being peppered with every day. And those stresses accumulate and can cause our body to be out of alignment and put strain on the structures, resulting in an L4-L5 disc bulge. The major symptoms of an L4-L5 disc bulge are obviously, number one is pain. Pain right in that area in the low back could be the result of an L4-L5 disc bulge. Sometimes it's not as obvious because you might feel radiating pain or referred pain to another part of your body. You can feel pain radiating into your buttocks or down your leg. You may even experience problem in your feet as a result of that. And so sometimes people don't realize that that could be associated with an L4-L5 disc bulge. And the third symptom of an L4-L5 disc bulge is actually not having pain, but other things like maybe just being stiff and losing mobility, or maybe you're sitting long and you have trouble getting up, or you get up and your body's crooked and your posture's off. So there could be symptoms that aren't even pain that are associated with having an L4-L5 disc bulge. So even if you're not in significant pain, you can have an L4-L5 disc bulge, and that could lead to bigger problems. So, they say the best time to take care of a problem is before it becomes a bigger problem. And that's a good reason to get checked for L4-L5 disc bulge, even if you are having minor symptoms. Sometimes people just think it'll go away or they can deal with it. But if you continue to have some of these symptoms, even just postural imbalances or stiffness, it may be a good idea to get this checked out. There are many treatment options available for an L4-L5 disc bulge. I will tell you about these treatment options, and I'm going to tell you the one most overlooked treatment option. And interestingly enough, the most overlooked treatment option is sometimes the one that's really going to get down to correcting the root cause of the problem. So discussing some of the treatment options for an L4-L5 disc bulge. There is, of course, physical therapy. This includes things like stretches and exercises, or passive modalities like electric muscle stim, ultrasound, heat or cold, dry needling, massage, soft tissue work. Then there is drugs, things like muscle relaxants or painkillers, or more significant drugs like steroid injections. And I prefer not to take drugs if I don't have to, because drugs always have harmful side effects associated with them as well. And then, of course, there's surgery. Most people really want to avoid surgery if possible, of course, because all of the negative possibilities associated with surgery, like nerve damage, muscle damage, inflammation, bleeding, infection. And even though with today's technology, there's less chance of these problems with surgery, it's always best to heal naturally if possible. Because once you surgically alter the tissues in your body, that can't be undone. So if your body can heal naturally, that's always the best way to go. And there's always a time and a place for everything. So I'm not saying that surgery isn't sometimes necessary, but it definitely should be the last consideration. And then there's chiropractic care, one of the most overlooked solutions to an L4-L5 disc bulge. Chiropractic care, if done properly, is safe, effective, and can offer a long-term solution to an L4-L5 disc bulge without the use of drugs or surgery. There's also non-surgical decompression therapy. This is a machine that will actually open the discs of the spine to help pull the disc back into place. Let me give you an example. If I were to take two vertebrae out of the spinal column, this is a model, they're actually larger than normal vertebrae, but if we pulled two of those vertebrae out, it may look something like this. And if I took those vertebrae and there's pressure on that disc. And once that pressure pushes out, it pushes that disc, it bulges the disc, and that puts dangerous pressure on the nerve. And that is often the cause of low back or leg pain associated with an L4-L5 disc bulge. So decompression therapy will actually decompress the disc. It'll pull the spine apart, and that'll open the space, allowing the disc to pull back in. If you'd like more information on decompression therapy, look at our webpage. There's a whole page showing decompression therapy and how it works. And that's a very effective treatment option for a L4-L5 disc bulge. A very exciting newer treatment option is something called cold laser therapy. Cold laser therapy is what it sounds like. It's a laser. You know, a laser could be hot, it could burn and cut. It's used in surgical procedures. But there's also something called a cold laser, which is very safe, and it's proven to be very effective at helping to heal L4-L5 disc bulge. The way that it works is the laser projects light into the cells, and it stimulates the mitochondria to produce more energy. And this therapy is proven to help the tissues heal faster, to help the blood circulation, to decrease pain and inflammation, and it's actually been shown to start to regenerate nerves and tissues. So cold laser therapy is a very exciting treatment option for not just L4-L5 disc bulge, but it's being used for many other conditions very successfully. And again, if you would like more information about that, see our webpage. There's a whole page dedicated to cold laser therapy, and you could learn more about that. Now, I'd like to share with you some easy, safe exercises and stretches that you can start doing at home to start to alleviate the pain and inflammation associated with an L4-L5 disc bulge. So I'm going to take you on over to the table so I can demonstrate those stretches to you. Okay, so now I'm going to share with you some simple, easy stretches that you can begin to do to help alleviate the pain associated with an L4-L5 disc bulge. And remember, before doing anything, if you're uncertain of anything, it's always best to check with a healthcare professional if you're not sure, because the last thing you want to do is injure yourself. Also remember, as you're doing these stretches, don't ever force anything. This should only be done to your tolerance, and it should feel good, or you shouldn't be doing it. So the first exercise is to get onto your back, and what you want to do, lying flat on your back, is bring your knee towards the same side shoulder. And what you're going to do is, if you can, you want to reach around your knee and just stretch those muscles in your low back and your leg, and allow your knee to come up towards your shoulder. I would do this nice and gently and slowly, bringing my knee up. Also, while I'm doing all these stretches, it's always helpful to breathe, to keep breathing. Sometimes when people stretch, they will hold their breath. So while you're doing this, it's always helpful to take nice, deep breaths. And every time you let some air out, usually you'll get a little bit more of a stretch. So whenever I stretch, I like to hold the stretch for a good 30 seconds. That gives the muscle fibers the opportunity to start to release. So another mistake I think people make is when they bounce like this. So I would just do everything nice, easy, gentle. Bring your knee towards your shoulder, and see, it should feel pretty good just holding that stretch. You're going to do that for 30 seconds, and you're going to breathe while you're doing it. Once I'm done with that, I'll back off a little bit, and then I'm going to bring the same knee towards my opposite shoulder. So I'm going to bring it across, and that affects a lot of different muscle fibers. And so you'll see that feels quite different as you bring your knee across to the opposite chest or to the opposite shoulder. Then whatever I do on one side, I'm always going to want to do on the other side to even things out. So I'm going to bring my other knee up, just like this, bringing my knee towards my shoulder, taking nice deep breaths, trying to allow my body to relax, letting my biceps do most of the work. So I'm trying to relax the rest of my body as I pull my knee towards my shoulder. If I can't get my hands around my knee, I might take a towel and hold the two sides of a towel, or even hold from underneath your knee until you get more flexible, and then you'll be able to easily hold your knee. I'm going to back off a little bit when I'm done, and then I'm going to go to the opposite shoulder, which is a great stretch. That feels really good. I feel that in my gluteal muscles in the butt area. And that can really take a lot of tension off those nerves that go down the leg. Once I do each side, the next stretch that I'm going to share with you is bringing both knees up. So now I'll bring both knees up towards my chest, just like that, and flatten my back against the ground. If possible, I would reach around and grab my wrist so I can just relax into this stretch. Once again, if you can't reach around your knees yet, you can take a towel or you can grab your knees from behind. But don't force anything. This should always be easy and it should feel good whatever you're doing. The next stretch I'm going to show you is called a pelvic tilt. So what we're going to do now is we're going to press the small of the back into the ground. So what I'm doing is with my feet on the ground, I'm going to press into my heels, I'm going to lift my tailbone up, and I'm going to just allow my spine to drop flat onto the table or the ground. You want to definitely be on a firm surface when you're doing this too. I don't think it's a good idea to do these stretches in bed. It's better to do it on, these tables are pretty firm, but you could do it on the ground as well. And so when I do this pelvic tilt exercise, what I want to do is I want to flatten my back into the ground. I'm lifting just my tailbone up. I'm not doing a bridge, which is that's a different exercise. We just want to stretch all those muscles in the low back and take pressure off of the discs in the low back. Again, if I have an L4-L5 disc bulge and I start to do this and it hurts, I would back off. I would only do what feels comfortable. And as you do this, the more that you do it, it usually gets easier to do more as your body adapts. So this next stretch, this pelvic tilt, we're going to just press the small of our back. And while I'm holding that, I will continue to breathe. And breathe through it, maybe 3, 4, 5 cycles of breaths while I'm holding that stretch. That feels really good. And the last stretch that I'm going to share with you is actually a twisting movement. So you can just drop your knees to one side or the other side, and that's going to help stretch through the oblique muscles of your low back. And so the way that I like to do this is I would get completely on my side first. From a side lying position, I bend my hips at 90 degrees and I bend my knees at 90 degrees. And then I'll take my arm that's closest to the ground and I'll hold my knees down so they don't move. And then I will open up my body with the other arm. And so I'm going to look over my shoulder and reach back with this arm. And that's going to get a nice twisting motion in my lower back. I'm going to breathe and hold 30 seconds. And this is one of my favorites. And of course, like I said before, whatever you do on one side, you're going to want to do on the other side. So I'm going to go to the other side. I'm going to bring my knee up. hold my knees down, reach across and around and look over my shoulder. Relax my body, breathe into it, and just let go. So those are some great stretches to start with for an L4-L5 disc bulge causing low back or leg pain. And even if it's not the L4-L5 disc, it could be a different disc, it could be a different joint that's causing low back or leg pain. These are some good stretches to get started with. You know, as a bonus, let me show you a couple of other stretches that a lot of the time, once I come out of these stretches, and you're on your back for most of these stretches, then I'll get on my hands and knees and I'll do a little cat and camel stretch like this. Or like a child's pose stretch, like this. Just to finish up and get things moving a little bit better before I get up off the ground, or in this case, up off this table. And now for your bonus. Thank you for watching so far. If you click on this link, it'll take you to a page where you can get access to our world-class chiropractic low back stretches. There's also a link in the description below. So I hope this video has been helpful, and now I'd like to hear from you. When were you diagnosed with an L4-L5 disc bulge? What treatments have you tried? What has worked or hasn't worked for you? Please write that in the comments. And if you think this video is useful, please make sure to like and subscribe to our channel so you can get more tips to living a pain-free, healthy, productive life. The next video you should watch is this one. This is a link to our world-class chiropractic icing protocol. These are instructions we've given to so many patients. It's been super effective at decreasing pain and inflammation and even facilitating healing. Go ahead and click on the link and check it out.